Well, hello, my name is J.R. Denson, and I am a public health analyst at the American Council for an Energy Efficient Economy. The American Council for an Energy Efficient Economy, ACEEE for short, if you haven't heard of it, is a research institution where we look into issues related to energy and energy efficiency, related to finance or behavior, utilities. And the newest program area mine is health and environment. The program officially launched this January, and I'm one of the folks on that team helping to get the program off the ground. So I want to take a look at, share with you with where we're going to be going over the course of this presentation. We'll talk about public health and its connection to energy efficiency. I think it's not super intuitive to a lot of folks. We'll watch a short little video detailing a very tangible real world connection. We'll talk about the project that I'm working on, those project details, the results of that project, and we'll wrap up with some case studies and where we're going in the future. So public health and energy efficiency, it's not, like I said, immediately intuitive how they are related, but they are very much so. If you see, look here, there's just a couple, these are a couple of examples of some energy efficiency measures that you can employ in a home or a workplace that have outcomes that not only save energy, but also improve health. So we see that interventions such as insulation and air sealing can improve the indoor air quality, regulate the temperature. We see things like ventilation and efficient cooking appliances can also increase or better the indoor air quality inside the home. And if that's poor air quality is affecting someone with some kind of respiratory illness like asthma or chronic obstructive pulmonary disease, COPD, better air quality can help them have fewer events where they might have to go to the emergency room or be admitted to the hospital. A lot of times when people talk about home health performance or increasing the environmental health quality of a home, a lot of the talk is around respiratory illness, and those aren't the only things that can be affected by poor indoor air quality or general and poor environmental quality. So there are respiratory illnesses like asthma, bronchitis, COPD, but there are also other things that can be exacerbated, made worse, such as headaches, heart disease like hypertension, that's high blood pressure. There can be a risk for lung cancer with radon coming in through maybe crawl spaces or the basement. Even mental cognition, your ability to think, can be affected by poor indoor air quality. So it's not just respiratory illnesses. These things can affect anyone, anywhere in the home, workplace, school, and so on. And so what we here want to do is think about addressing these issues proactively. If you see somebody being put into an ambulance and getting CPR because they almost drowned in a river, that's a tertiary response. We're saving that person who almost just drowned. Now, we could also put lifeguards along the river to save people before they almost drown, right after they've fallen in, or we could go all the way to the source and just fix the hole in the bridge that people keep falling into. That's the primary intervention. So this is the upstream, downstream public health approach to dealing with issues, with dealing with problems. We want to fix the problem at the source instead of fixing it down the road. So we want to be more proactive, more preventative healthcare. And that's what we're doing when we're talking about this dual energy efficiency health aspect. We're looking at what can we do to reduce triggers in the home that might lead to an asthma attack. We want to mitigate those triggers so that we don't have to go to the emergency room, or we can use fewer asthma inhalers. We don't have to take as much Advil for those headaches. So the average emergency room cost in the United States is about $2,000. If you've got insurance, you probably see you don't see that number. You probably see a number that's lower, but if you don't have insurance, on average, this is about how much it costs just for an ER visit. At admission, Staying overnight is significantly more expensive, $20,000 on average, if you have to pay for that out of pocket. Being preventative, doing this work ahead of time, having healthy heart, clear mind, clean lungs, well, that's of course priceless. So what I want to do right now is show a quick video that makes a very personal, real world connection to how these things are related. And we'll watch that now.
It's a terrible feeling when you're at the hospital and your child is hooked up to so many breathing machines. My 2-year-old son was diagnosed with asthma pretty early on. I didn't know much about asthma. I knew what it was, like a respiratory issue, but I didn't know that it had triggers and it advances really fast. He would have a lot of asthmatic reactions at home. So I started to think about what's making him go off, what's making his, respiratory issues even worse. My 7-year-old was diagnosed with asthma at 2 years old. He still suffers from asthma attacks at some points during the seasons, when it's a big weather change from winter to spring. So I have to make sure that we maintain the proper temperature inside the house. I had a lot of issues with some rooms being really hot, and in the middle of my house, for some reason, it stayed cold. It seemed as though there wasn't no heat getting in the middle of the house. If the room was too warm in one place and then he goes to another part of the house and it's hot, I feel like we would have to monitor him. Once the initial assessment and they came in and told me all the things they did, I was excited that I was going to be able to get these things done in the home. Me not knowing that it wasn't any insulation in there really had me thinking, what else is it that could be done? We went around the home and she was able to pull out and hand pick, hey, this is a trigger for him. This is a trigger. Don't use this kind of cleaning product. So she basically addressed, hey, maybe we need to seal up, insulate some areas in here and see if that kind of reduces their reaction to, a lot of the spores and things in the outside air that they, come in contact with in the morning. They sealed off all the entryways and exits, and they put a big blower here, and they were able to make sure I was at a place where there was no additional air coming in. After that was done, I can definitely say that I've noticed a change. No more drafts coming in and out of the house, not having the exposure to the outside elements and the things that trigger his asthma. Those things significantly decreased his asthma attacks. So we went from him having an asthma attack, let's say once every 4 to 6 weeks, to twice this year. Since we had the weatherization program done in our home, the heat is more consistent throughout the house. So I did notice this past winter that he didn't have to have as many breathing treatments. We didn't have to use as many rescue inhalers as we did prior to this being done. So it helped out. I feel as though it helped out a lot. I'm Mama Bear, I'm always alert, but he tends to roam freely now that I don't have to make sure that he stays in one specific area of the home. What the program did for me, it was a catalyst for positive change. When my kids are home, I know that they're safe. I know that they're breathing in clean air. I know that I'm cleaning with the proper cleaning products and not overexposing them to a lot of chemicals that they shouldn't be exposed to in their home where they sleep. So when you say your home is your sanctuary, it truly is. And I keep a lot of that other stuff out.
All right. So we have a couple more videos similar to that. This one is set in Baltimore, Maryland. We have one in West Virginia, and the other is in Pittsburgh, Pennsylvania. And I'll have the links to those videos at the end of this presentation. So what was this project that I did all about? And it was related to what you just heard in that last video. It's programs that simultaneously address energy savings and the improvement of health in a home. And so we're looking at programs that do just that. So how does that work here at ACEEE? Well, we often do every couple of years what we call exemplary programs projects. And this is what it sounds like. We make a call for nominations of certain programs. In this case, it was programs that address both health and energy efficiency. And we have a panel of judges that help us not just judge which programs they think are exemplary, but also serve as advisors to help us determine what kinds of questions we should be asking, what kind of criteria we should be using to kind of select which programs we're going to select. And so here's the definition that we came up with for these programs. We discussed that, and they oftentimes in many states, they might not be called this. They're probably not. This is the name we made up for ACEEE. But in many places, these programs may be the State Weatherization Assistance Program, WAP, or it may be a health and home performance program. They go by different names, but ultimately they're all doing the same thing. So what kinds of things are these programs doing? These are a list of common offerings. This is not an exhaustive list, not everything, but this is some common things that they do. So some programs might do all of these things. Some programs might do one or two. So for example, program A might be doing energy audits and some education coaching. But program B might only be offering some financing to get some repairs or retrofits done to the home. And program C might be doing everything you see here. So where are these programs? What kind of communities are they serving? They're all over the place. They're in cities, they're right outside of cities, they're out in rural areas. However, there aren't any programs that were nominated for our award that we saw that were only serving rural areas. We did see programs that were only serving urban areas, and but none that were serving rural areas specifically. We had about 49, we had 49 nominees total after we took out some of the duplication. Some programs were nominated more than once. You can only be nominated once. And so of the 49 programs that were nominated for this award, there were a concentration of nominees from the Northeast and Mid-Atlantic area. And lastly, about a third of the programs were targeted at low income. There were some programs where it didn't matter. The program was for market rate and for low income. It scanned the spectrum. And there were some programs, again, that were specifically for low income. Types of buildings. Most of the nominees are serving the residential sector. And a lot of the programs, of those serving the residential sector, most of them were focusing on both multifamily and single family. There were some that were only one or the other, but there was a bigger percentage of them that did both. Likewise, and at the end here, we see that most of the programs, I think there were only 3 out of the 49 that were building new homes. The rest were all serving homes that were already built, whether they were retrofitting or educating or doing something to that effect. Funding, where are these programs getting their money from? Most of them are getting their money from several sources. So you see there 55%, the top right corner there, 55% have multiple sources. And if you look here on the left, this little funky bar chart, horizontal bar chart, you can see the mix of where these programs are getting their money from. On the bottom right, you will see that most organizations, followed very closely by utilities, most organizations, programs that are doing these kinds of interventions get their money from the local, state, or federal government. So it's usually WAP programs, weatherization assistance programs, or some other pot of money from the EPA, Environmental Protection Agency, or DOE, Department of Energy. Local utilities were really close, gas and electric utilities, some private investors after that, and then foundations were last there. So now I want to look at, just highlight a couple of programs. These aren't necessarily program winners. I wanted to just highlight some programs that were different and also some that were specific to your neck of the woods in North Carolina. So this program, the Zero Energy Modular Program, one is in Vermont. It serves the whole state. One of the things that's interesting about this program that no other program was doing is that this one focuses specifically on manufactured homes, modular homes, and all of the homes that they build are zero net energy, meaning they produce as much energy as they consume. So that uses solar panels and backup batteries to be able to create and save energy, along with some other technology that they use in these homes. They have some relationships where they're able to offer some financial incentives, and this is just a pretty innovative program that we thought kind of stood out and was a little bit different. The Green and Healthy Homes Initiative is a program that is based out of Baltimore, Maryland, but is in, I believe, nearly 30 states right now. One of the things that stands out about this program is this holistic approach. They really do put a heavy emphasis on both energy savings and improving the health of the folks that live in the home. This program was doing a really good job of tracking their health and energy outcomes. How much energy is it saving? Electricity, gas, water. How are the residents, how is their health status changing before and after this program is being done? This program, Vermont One Touch, so what it was also nominated. One Touch is a program that's in several states as well. Not as many as Green and Healthy Homes, but definitely in several states. Of the One Touch programs, the one that was nominated was Vermont. However, there is a One Touch program in Greensboro, North Carolina. And among all of the One Touch programs, one thing they do really well is establishing collaborative relationships with community-based organizations that may offer some social services, with state agencies like state WAP programs. They are pretty comprehensive in their offerings. They try in all of their locations to offer a no wrong door approach, which means that you can go to any one agency, and if you need braiding services, you need more than one thing. So if you need weatherization and you also need help with Social Security, and you also need help with food or WIC assistance or SNAP, you can go to one place and fill out one application and have be enrolled into all of those services and not have to go to different offices to have all of your needs taken care of. And this last one here, System Vision, is in North Carolina as well. This one serves the entire state. One Touch One Touch is only in Greensboro, but System Vision serves the entire state. And similar to the ZEM program that I mentioned in Vermont, this one builds new homes. And one of the things that stands out about it, well, two of the things I think that stands out about it, this one has been around for a long time, about 30 years, a little over 30 years actually. And they also have a comfort and savings guarantee. And so once they finish the home, if the thermostat is not in line with what the actual temperature in the home is at any point, they'll come out at no extra charge and they'll fix it, and they'll reimburse whatever the additional utility costs were for that time where it was not functioning properly. So what does this mean for you? Well, depending on where you're coming from on this issue, this can mean or be helpful in different ways. So as an individual, let's just say you're a college student who lives by yourself or with a roommate, and you like me went into your kitchen and realized that duct above your stove, above the hood range on your stove, isn't actually connected to anything. It's not sending that exhaust out of the house. It's just circulating back into the kitchen. Well, maybe this information is helpful to you to learn how to take care of yourself and your house, and some tips to make your home healthier for yourself. Maybe you have a family and someone in your family suffers from migraines or headaches or COPD or some other chronic disease that can be exacerbated by poor indoor environmental health. And so this information can help you better take care of your family. Or maybe you run a business, maybe you're a contractor, and you want to learn how to get more involved in organizations like One Touch or System Vision, who help train contractors to be certified. System Vision has a certification for contractors to be able to obtain and then be able to take part in their program and build houses. Or maybe you don't want a business, but maybe you care about the affecting change in the larger community around you, and you want to work with whole neighborhoods and blocks to be healthier. There's a program in Philadelphia where that's what they do. They work with groups of homes, not just specific homes, to make them all healthier. Lots of homes up, particularly in the north, where you have row houses, or even other parts of the country with duplexes, homes that are connected. It's not just one home, it's a community together, and you want everyone to be as well as you, hopefully. And here there are people who maybe you are a policy influencer. You maybe work for a state legislature, or maybe you work for a policy department at a utility. And you want to learn more about how to institute these kinds of programs where you work in your state or at your organization. If you're at this level, the public policy level, you have some influence, and you can learn more about these programs and how they can improve your community. So no matter where you're coming at this from, there is the opportunity for you to engage at a level that's appropriate for you, or even across levels. So where are we going? What's the future here? So I mentioned before, I'll get into that in a second, where the future work that we want to work on. So this picture here, I really like this illustration. I think it's kind of funny. I think it has two meanings, and maybe I'm just exaggerating a little bit, but I think that the two meanings are kind of funny. And I'm not sure which one the illustrator meant. It could be the maybe common idea of what this picture might be, where we're leaving the past and we're riding off into the sunset for a bright future. I think that's what it might be. Or this could represent leaving the past, which may or may not have been good, and rocketing to our death into the corona of the sun. I'm not sure what the artist meant. I'm choosing to believe he or she was referring to the more positive former view of what this image is, and riding off into the sunset. Why does this matter with this work? Well, depending on how you feel or what you think about certain political issues, you may or may not be enthused or concerned about how your work is going to be affected in the realm of energy or environment, or so on and so forth. And I'm choosing to be positive about this. I think that there's a lot here to be done. I think that, especially when it comes to health, that it's not a political issue, and most people agree that being happy and healthy is a good thing, and don't believe that's a partisan thing. So I think that's great, and I think that there's a lot of promise in this health and energy linked health home performance area. So future things that we're hoping to learn about and see in the future. One thing we want to learn more about are, we know anecdotally that there deferral rates are really high for these kinds of programs. A lot of folks are turned away because the health and safety of their home is so poor that the weatherization measures that could be implemented aren't implemented because so much work prior needs to be done. And that's anecdotal. We want to look more into that. We also have learned that a lot of programs, specifically the ones that are nominated, they're really good at tracking their energy outcomes. The mechanisms for being able to determine your health energy savings are pretty well established. The evaluation, measurement, and verification of those things is a well-known and practiced a well-known practice. But conversely, doing so with health outcomes is not. And so that said, we didn't get a whole lot of health information from folks. Only 2 programs gave us any health outcomes at all. And so we're continuing now to do follow-up with some of those programs. Some did have some information, just wasn't ready to be shared yet. And so we're in the process now of following up with those programs and getting some health outcomes. How are people feeling? What are the results of the intervention health-wise after these things are over? And lastly, we also want to look into using energy efficiency money healthcare money to pay for energy efficiency measures. As I mentioned at the very beginning of the presentation, instituting these kinds of measures preventatively is a type of preventative healthcare. And so we want to look into using CMS, that's Centers for Medicaid and Medicare. So Medicaid, Medicare, CHIP, that's Children's Health Insurance Program, using those kinds of dollars to pay for this kind of work. There's one program that is doing that in the city of Memphis. And we're hoping to learn more about that and how there are other states also doing similar initiatives. So as promised before, here are the links to the other 2 videos that I haven't showed you. Also here, there was a report called Saving Energy, Saving Lives that was just released a few weeks ago about how the outdoor air pollution, ambient air pollution, if you use energy efficiency to mitigate that, how it can improve health in the 50 largest cities in the United States. My report on this presentation that we just went through is going to be coming out March 27th, so keep an eye out for that. And lastly, shameless plug for some of our conferences we'll have later this year. In particular, I want to highlight our Health and Environment Conference. This will be the first one that we've done. It'll be in New Orleans the first week of December, where we'll be talking more about all of these issues and more that I spoke about in this presentation. So I want to thank you for your time. Thank you for listening. Here's my contact information here. Feel free to reach out via email or phone anytime. I'm happy to answer your questions or talk at any time. Thank you.